Hi friends, this is Dr. Abdequaem Chimthanawala. Today I'll discuss a very important polychrest remedy that we all have read in our practice, that we all have prescribed in our day-to-day remedies, but a very important because I only deal with the face symptom of that remedy, only the face symptom, because I have found it very useful in order to enter the case through face. And the remedy which I am talking about is a very important polychrest, that is Silicea. If you look at Silicea, the most important symptom that comes to our mind is the abscess. But now, in relation to the face symptom, you have to remember, in Silicea, it is indicated for abscess of the parotid gland. I have cured number of cases where the patient was suffering from abscess of the parotid gland. Now, you have to remember this symptom in comparison to other remedies also. The two remedies that come to my mind with Silicea I have to compare is, first is Arsenic album. Arsenic album, Phosphorous, Lachesis and Rhus. So these 3-4 remedies are very important in abscess of the parotid glands with Silicea. Silicea is also indicated for abscess of the submandibular gland. Remember, abscess of the submandibular gland. And here also you have to compare with Phosphorous, calcarea and Lachesis. Lachesis is also a very important remedy with Silicea with abscess of the submandibular gland. So, abscess of the parotid gland, abscess of the submandibular gland. It is an important remedy for cancer, epithelium of the lower lip. A very important remedy, and this is a very important indication of Silicea also for cancer. With this, you do compare Silicea with Merck Idoflavors. Very important remedy, and of course Phosphorus. 2 remedies and Arsenic. So these 3 remedies you must compare this cancer of the or epithelium of the lower lips. As you go, it is also, as you know, it is also indicated for serous cancer of the face or of the lips also. Next important symptom. In face, the very important symptom I have found Silicea is necrosis of the lower jaw. This is a very important indication. If you are lucky to have such type of cases, you will be very much happy to see that Silicea gives a wonderful results. Though most important remedy is definitely Phosphorus, but with Silicea we have to compare Silicea, phytolacca, nitric acid, a very rare remedy called Cistus canadensis or Conium maculatum. In fact, acid floor is also very important with Silicea when there is necrosis of the lower jaw. A very important indication. Of course, Silicea is, if you want to see Silicea, you have to see the lips, cracked lip. That is a very important indication of the Silicea lips. Now the face. How is the color of the Silicea face? In Silicea, the discoloration is either reddish, pale or earthy discoloration. This is a very important indication of Silicea. It is pale, earthy or red. Sometimes in mathematics it is also written as yellow in color. Next, there is dryness. Now in Silicea you have to remember dryness of the lips, general dryness of the lips, and of course there are many of remedies with Silicea which have dryness of the lips like antimcrude, you can take bryonia, you can take hyoscyamus, you can take nux mosquita, pulsatilla, rustox, or one remedy that comes to my mind is veratrum viridi also. So whenever if you see the face, you see the lips, you see dryness. So immediately about 5-6 remedies that comes to, that should come to your mind apart from other remedies also. One of them should be Silicea. Now Silicea is very important remedy for eruptions, especially on the chin and on the lips. Because chin and lips basically you find Silicea indicated. So it is indicated for acne also, especially acne rosacea. And in Silicea, if you want to know the site of the eruptions or acne, it is on the forehead. Now, whenever there is acne or eruptions on the forehead, there are few remedies that should cross your mind. Silicea, sulfur, rustox, sepia, hipersulf, causticum. These remedies are more inclined to have eruptions or acne on the forehead. Of course, they can have anywhere on the face, but this is the indicating feature. Now that there are varieties of eruptions on Silicea face, that is, eruptions are crusty and scabby, especially on the chin. Eruptions, boils, small boils, or eruptions sometimes very moist. And in Silicea, you have to remember if there are eruptions, there are pimples, especially on the lower jaw. This is a very, very important indication of Silicea. And with the, in fact, in Silicea, if you have eruptions, especially on the lower jaw, you must think first about Silicea. Also, you can think about arsenic album, one rare remedy called Paris quadrifolia, or mephitis also. But Silicea stands first in the list. If you have eruptions on the lower jaw area, you must think about Silicea. So these are the various eruptions basically about Silicea. Now the expression. Silicea patient, the expression of the face is absolutely sickly. Lot of expression of suffering on the face, like this. Suffering. The expression is very sickly expression on the face. That is the expression of the face of a Silicea patient. Of course, I have told you the Silicea indications on the parotid gland, on the submandibular gland. Of course, you can definitely have inflammation also of these glands. That is also basically Silicea. Now, the pain of Silicea. Silicea is indicated for face ache or prosopalgia, in which the cold application aggravates. The cold application aggravates. Very, very important indication of Silicea. Compare this with carb OH, magnesium carb, and magnesium phos. So, face ache, prosopalgia, which is aggravated by cold application. Very, very important indication of Silicea. And exactly opposite is it is written in a Mater Medica. Pain of the face, prosopalgia, which is better by heat. Better by heat, especially it is written in a Mater Medica, better by heat of the stove. Now, with this, you have to remember only one remedy that comes very close to Silicea, and that is miserinum. See the face symptom of Silicea, very close to a lot of remedies. So whenever you're thinking about a remedy, when you see a case of Silicea, at least 5-6 remedy that should come to your mind when you're thinking about Silicea. Now the swelling. Of course, the areas you know, the parotid gland, the submandibular gland, the lips, and the jawline. So you can have abscess there, you can have inflammation, or third, you can have basically swelling. So swelling generally of the lower jaw bone or the lower jaw of the cheek. This is also Silicea. And the face of Silicea, as it is written in a Mater Medica, that you all should know, that is waxy face. This is Silicea. And now I would like to share some of the symptoms that are very, very peculiar to only Silicea, and that should come first in your mind. And what is there? In Silicea, it is basically indicated for cancer, sclerus of the upper lips. Sclerus, cancer of the upper lip, a very, very important indication of Silicea. And you can say the cracks in the margins of the lips. Cracks at the margins of the lips. In Silicea, the toothache also is very important. There is pain, burning of the face with toothache. So whenever with toothache, the patient tells you that there's pain which is burning on the face, you must think about Silicea. Or for example, if a patient comes to your OPD and you're practicing on the first floor, the patient climbs the stairs, he comes in your chamber and there's perspiration on the face. Immediately, the remedy should come to your mind. Only perspiration on the face after exertion, and the remedy is Silicea. So very common of Silicea. Next, as it is written in the Mater Medica, twitching. Twitching of the jaw, especially lower jaw at the night. A Silicea patient, a mother will come and tell you the child has twitching of the lower jaw at night, and you must think about Silicea. So this is the only remedy Silicea. In fact, if you say ulcers around the mouth, on itching, or on the corners of the mouth of itching, that is also Silicea. So these are basic remedies, indications of Silicea. One symptom I am getting in my mind of Silicea, that is the twisting of lips during convulsions. If you have no symptom of that of convulsions, and the patient comes and tells you, or the attendant or the relatives who have seen that twisting of he has seen the convulsions of the patient, if the patient comes and tells you twisting of the lips during convulsions, my dear friend, the only remedy that you should remember, it is written in a Mater Medica, and the remedy is Silicea, and like this you can cure a case of convulsions by a single dose of Silicea. So these are the very, very important indication of Silicea phase which I have seen in my practice and confirmed in my practice. So these symptoms are worth reading. Of course, there are a lot many of symptoms in our Mater Medica. Please go home and read. But these symptoms which I have told you are the clinical symptoms which I have seen in my practice. So if you like this video, my dear friends, please do share and subscribe. Thank you.